The city reported more than 3,970 new local COVID cases and around 300 imported infections. As 6 more elderly COVID patients died, authorities are urging infected people to seek medical help as soon as possible, even when these symptoms are mild, to prevent complications. Jackie Lin reports.
Hong Kong reported more than 4,000 new COVID cases for the 6th consecutive day. Among the 6 COVID-related fatalities, 4 of them are hospital patients with chronic illnesses. The other 2 patients include an unvaccinated elderly woman who had a history of stroke, dementia, and heart disease. The 84-year-old passed out at home last Monday and was certified dead at the A&E department on the same day. She tested COVID positive posthumously. The other one was an 88-year-old woman with no chronic illnesses. She developed respiratory symptoms on July 11th and tested COVID positive the day after. She was prescribed antiviral oral drugs at designated COVID clinics. Still, she lost consciousness on the street 5 days later and died after being sent to hospital. With a rise in people dying from the virus at home, authorities are urging COVID patients to seek medical attention even when the symptoms are mild, especially the elderly.
The elderly, so we urge them not to overlook their symptoms because most of the time they are asymptomatic. But as just mentioned, their situation or their condition can deteriorate quite rapidly.
Authorities added more antiviral oral drugs will be prescribed to prevent severe complications among COVID patients. With 1,000-strong caseloads every day, the Penny's Bay Isolation Facility also set a new high for admissions since June. Around 5,200 people are undergoing quarantine at the center, which is 60% full. Following a slew of complaints about the facility's arrangements for providing daily necessities, the authorities admitted under the current centralized mechanism, it took more time for staff to cater to the needs of the quarantined individuals across the 1 million square foot facility.
The government is very concerned and is closely monitoring the pandemic situation, and we are also reviewing our community isolation facilities.
The facility has now adopted a new zoned management system under which each team of staff will take care of 60 to 80 rooms at Penny's Bay. There will also be 3,000 units in other community isolation facilities ready for use once the need arises. Jackie Lin, TVB News.